Welcome back to another episode of Voices of Vitality, where we have conversations with experts who help us live healthier, fuller lives as we age. Today, we're talking about something that affects every single one of us, but is definitely not discussed enough, and that's mental health. As we get older, life throws all kinds of changes at us: retirement, health concerns, caregiving responsibilities, losing loved ones, changing family dynamics, and shifts in identity. All of these things can really take an emotional toll. Yet so many people grew up believing they should simply be strong, keep their feelings to themselves, and just keep pushing through. The truth is, taking care of our mental health is just as important as taking care of our physical health. Anxiety, depression, grief, loneliness, and stress are really common experiences. They're absolutely not something that we have to navigate alone. I am so excited to welcome Karen Van Slyke to the podcast today. Karen is a licensed therapist with extensive experience helping people work through life's challenges with compassion, practical tools, and hope. Today, we're going to talk about some of the most common mental health challenges that older adults face, how to recognize when it's time to seek support, and simple strategies that can help us build resilience, emotional well-being. So whether you're navigating these challenges yourself, supporting an aging parent, or caring for a spouse or a loved one, my hope is that today's conversation reminds you that asking for help is actually a sign of strength and not weakness, and that it's never too late to invest in your emotional health. So Karen, thank you so much for being here.
Thank you, Jenna, for having me.
Absolutely. So tell us a little bit about yourself and what drew you to becoming a therapist.
Okay, well, I've lived in West Michigan for about 25 years, and I've known since I was very young that I wanted to be able to help people. I noticed early on that I could quickly observe that people were uncomfortable in situations, and I thought, why not get trained and find the actual words to use to be helpful?
I think that's great. So from an early on, you knew it was a calling.
Yes.
So do you find that mental health challenges or mental health concerns change as we get older?
Yes, as you already mentioned, there are several shifts that occur in life when we transition through life. You know, people have different responsibilities through different phases of life, and sometimes it's difficult to adapt. And that can be a point where someone gets snagged and would perhaps benefit from some professional support.
Absolutely. And so what are some of the common emotional struggles that you see in adults over 55?
Sometimes it's letting go of relationships, whether it's from passing of a loved one or divorces that are occurring later in life. Sometimes it's accepting the changes that come with aging, and those can include the changed physical response to what we're used to doing, you know, giving up long-lived, enjoyed exercise or routines because of injury or just because your stamina is different. And then there's also just the change in where you find meaning. You know, as children leave home, as they enter into their own adulthood, sometimes parents are finding themselves offering a lot of support. Sometimes they're finding themselves on the peripheral and not knowing how to help. So it can be difficult to navigate.
Yeah, absolutely. We see definitely with our clients so many of those different things. I just assessed an individual yesterday who he and his wife moved to Western Michigan 2 years ago with the idea that they were going to be closer to their daughter, son-in-law, and their kids. Well, it turns out their kids, the grandkids are in high school at this point, and the family is just so busy. And it was interesting because we had a segue for a long time because the conversation took a turn to that challenge of like, we moved here, we know nobody, right? We thought that this was going to be such a great thing, living closer to our daughter and our grandchildren, but now it's not panning out that way. And now they're struggling with finding their sense of purpose in a new town.
Sure. And trying to find their peer group and trying to connect with activities they enjoy, trying to make meaning out of, okay, here's this novel situation and how do I problem solve through it? And that can be isolating, that can be frightening, it can be anxiety producing, and it can
For
be
sure.
something that people experience as very sad.
Yeah, absolutely. So when someone is experiencing, signs and symptoms of mental health challenges, when do you sort of segue from this is just normal aging, or when people should actually pay attention and seek out some help?
So with the aging process and the sadness or anxiety that can come with it, I would say it's really important to look for help when you're seeing a loss of interest in previously enjoyed activities, when you're
Mm,
seeing a lack of initiation to get started in the day. For example, someone whose hygiene has really been impeccable is suddenly, they haven't showered for a couple of days. They're suddenly looking a little bit unkempt, or they're declining social uh, invitations. And, maybe you're a family member and you're noticing, gosh, I haven't heard from mom. Or, gosh, dad hasn't left the house in a couple of days. Or every time I go over there, they're sitting. I wonder if they leave in between, so when
mhm.
you're observing maybe some changes in your loved one, or for the individual themselves, are you feeling more sad than typical? Are you grieving and tearful? And are you noticing that you're maybe having appetite changes, sleep changes, those kinds of things?
Yeah, and I'm curious to know, so I think that the baby boomer generation grew up with this mindset of, just push through, it's fine, take those feelings, just sweep, sweep under the rug, it's not a big
Yeah.
deal, keep moving through. How do you feel like that ingrained mindset in these individuals is impacting the way that they approach these changes in mental health as they get older?
I think it's meant to be like, okay, kind of that can-do spirit. And so we can embrace that a bit, but we can't embrace it to an extreme. Because if we ignore our emotions, they end up coming out in other ways. And so I think it's probably a well-intended path to say, look, I've got some confidence in myself, I can do this. And that's a fair thing to say. I think when it gets to be a bit extreme is when you're saying, I'm now going to ignore this pain that I feel and I'm going to stuff it, because then that just goes into that category of, I'm not right for feeling this. I'm judging my own emotions as wrong. And, that becomes so complicated for the individual and then further stigmatizing.
Absolutely, absolutely. So I know that a lot of the changes that happen with aging can be very anxiety provoking in individuals. Do you find that older adults sort of manifest or demonstrate anxiety differently than maybe the younger population?
There's sometimes a bit more perseveration where they might lock in on a topic and think, well, this is the only way I can go forward, is if I can still do the things that I used to do. Um, I think that there's also that sense of sadness with letting go of, here I was this business executive, for example, and as I transition into retirement, now how do I define myself? And so it's kind of
Mhm.
that loss of identity, and then that experience of maybe a bit of rigidity with, how do I experiment? There's maybe a
Yeah,
little less of that willingness to trial new things because there's so used to a standard of performance that
yeah.
they forget that sometimes we make mistakes as we start something new, and that's okay.
Yeah. Do you have strategies that you encourage your clients to start using when in something like that? I know we see a lot of times difficulty in our clients with goal setting because
Yeah.
their physical abilities do look very different than they
Mhm.
did, especially after an injury or an illness or something like that. They're looking back at, not, I wouldn't even say like 3 or 6 months in the past. They're looking back 5 years in the past and they're saying, well, I can't drive anymore and they won't let me mow the grass anymore and I can't do all these things. So what's the point? And it's like, well, there are other things that you can do. So I'm curious to know what kind of strategies you use to help people that have that mindset of I'm not going to look like I did, or I'm not going to move like I did, or do what I did 5 years ago. So what's the point?
Yeah. Well, I think one approach is to modify that all or nothing stance and say, well, what's one way you can move toward something that you might enjoy? Because, for example, you can go out for a walk for 15 minutes. It doesn't have to be an hour-long walk.
Yeah.
You can go to a social event at Meyer Garden or wherever you choose to go for a part of the time. It doesn't have to be the full 3 hours. So sort of teaching a bit of that flexibility and breaking tasks down into more manageable steps and then gradually building in from there.
Yeah. And I do know we see in our clinical practice again a lot of depression, because
Mhm.
the one of the biggest losses as we age is a loss of function and functional ability. And that really hits people hard. And I think that in the older population, depression oftentimes does go unnoticed. So what are some of the warning signs for depression that people or adult children of aging parents should be looking out for?
Well, it would be that low mood. It would be the lack of initiation. So the lack of starting things. It would be low motivation to participate in daily routines. It would be a change in weight or, so that can be either up or down. It would be recurrent thoughts of death and,
Mm.
talking about that topic. Sometimes it's not, pathological to discuss passing when you've lost a loved one. However, if your loved one continues on that trend for consistent periods of time, you might want to check in.
Yeah.
Um,
How does that check-in conversation go? I know I have a lot of caregivers and even myself, right? When I'm in clinical practice, I can see these like low moods, changes in appetite, all those things happening, but the conversation can be really sensitive. So how does that conversation even start?
yeah, that's a great question because it can be as basic as, hey, I want to check in with you. And you can actually say that, or you can say, hey,
Mhm.
I'm wondering if you're a little sad. I see that you look like you haven't slept. You look more tired than typical, or I notice you're moving a little bit slower. Have you noticed anything different? So it's not a judgment. It's
Mhm.
mainly just a gentle observation. And I care about you, and so I want to ask you a question. Is it okay if I ask you a question?
Yeah, I like that. Asking for permission, I think that's
Hmm.
definitely makes things a little bit easier to digest.
Yeah.
So now the grief and loss are very common as we get older, right? We have a lot of clients often tell us, this is just in my age of loss after loss after loss. You spend your time when you're younger going to weddings and baby showers, and now they're going to funerals of people. So how do you help people navigate these losses, like the death of a spouse, or I mean, retirement is a pretty big loss as well. I mean, we talked about earlier, a huge shift in people's identity or health changes, losses of independence, those sorts of things.
For a lot of people, it's important that you validate that, of course, you're feeling this way so that they, again, don't judge themselves for that sorrow that they're experiencing, because it's reasonable that someone would be sad with the passing of a loved one or the transition out of a vital role of employment. It's reasonable. And then it's about, really processing that with them. What does it mean for you to let go of this role? What have you considered as alternatives? So to try to guide them, as a practitioner, try to guide them through a little bit of curiosity, because
Yeah.
it's often that people have this rigid expectation, either in this or in that.
Yeah. And I like that approach too, because I see a lot of adult children approach their parents in a manner of, you should do this. You need to go out. You need to join the
Yeah,
senior center. You need to go meet with friends. You need to go learn how to play mahjong. And
yeah,
that just feels, I mean, to me personally, that feels overwhelming. And I'm not even dealing with a loss or grief.
right. Yeah, it can be hard to be told what to do. Seldom do we receive that well. Um,
Right.
it is nice when we can come alongside someone and say, "Are you interested in what I think?" I think there've been some changes, and I'm wondering if, you have an opportunity to maybe seek out a neighbor, and could you go for a walk with Mr. So-and-so who lives next door? Or would you let me know if you'd be willing to go out for dinner? Because I'd be happy to invite you. Can I call you on Thursday and see how you feel about going out? So it's kind of that gentle, yeah, but assertive kind of pace, especially
Yeah,
if it's a
nudging
parent.
along, nudging along.
Yeah, yeah.
Yeah. So now with losses, then oftentimes comes loneliness, social
Yeah.
isolation. What sorts of things are you seeing as far as how this loneliness and social isolation can impact an individual's mental health?
Oh, with isolation definitely comes the unfortunate opportunity to engage in a lot of rumination about the past and worried thoughts about the future. And so that's why isolation is so detrimental. And so we want
Mhm.
to encourage people to even, just go outside, right? Just step outside your dwelling, find a comfortable place to sit on a porch, take an opportunity for a drive if you're able to drive, or be willing to visit with a friend who invites you out, but don't have expectations that you have to perform at such and such level, right? Just accept your loved one or your friend is inviting you out because they care.
I love that. Absolutely. And so we see a lot of individuals who have caregiver support. And I think that caregiver support is, caregivers also face a lot of mental health struggles and challenges. And I tell my caregivers that being a caregiver is the hardest job that they will ever have to do in their lives. What do do you see caregivers? Do you counsel with caregivers? And what sorts of tips and tricks would you give caregivers having to deal with stressful situations with their loved ones?
Yeah, that's excellent. Of course, there are support groups, right? And there's a reason there are support groups for caregivers, is because there you are, the caregiver who loves this person. So it's a dual role.
Mhm.
You're providing support and you're watching the person you love go through something difficult. And none of us who are compassionate really have a lot of fortitude for doing that without breaks. So you need breaks. You need to not stigmatize yourself when you feel frustrated with your loved one, because it's bound to happen, right? That
Absolutely. Oh, so
in those,
frustrating.
yeah, in those close situations, right?
Yeah.
And that you need to take time for yourself.
Yeah.
Self-care is not selfish,
Yeah.
right? So managing your own health, making sure that you socialize with people, making sure that you're connected to supports like groups or your own counseling if you're a caregiver, because these things are difficult to navigate. In fact, I have counseled individuals who are the caregiver and their loved one has the chronic condition. For years, I
Hmm.
did neuro rehab. And so I would work with the families in tandem with the individual because they were trying to make sense of all the changes as well.
Yeah. I mean, I think that that caregiver role impacts these individuals just as much as the illness or the injury or the chronic condition is impacting the person living with it. And I think all
Right.
too often caregivers have that sort of I can't take care of myself because it is selfish mentality. And the reality is they can't do a good job of taking care of their loved one unless they're taking care of themselves.
Correct. It's the whole airplane analogy. You have to first don your own oxygen mask before you can offer assistance to someone else. If the caregiver is not well cared for, then they're not able to support well the others in their life.
Yeah, I love that. Now, if someone listening is feeling overwhelmed just by life, by aging, all the things, what are some simple things that they can start doing today that can help support their emotional well-being?
Well, some of those things can be to practice mindful breathing. People may or may not have heard of that, but really what it does is it allows us to allow our brain to do the emotion regulation piece that it's known for. So when we slow our breathing by breathing in through our nose, say to the count of four, holding it, and then exhaling longer to the count of 4 or 5, then that helps initiate what we call the relaxation response. So that sends feedback to our brain that, okay, Jenna's relaxing. Okay, Karen's relaxing. And then as we relax, emotions come down, and then we're able to problem solve a little bit better. So that's the thing I love about mindful breathing. You can do it in those quiet moments at home before you start your day, or you can do it in the throes of what could be a very tense situation to help regulate yourself.
And about how long do you suggest people do those breathing techniques for?
You know, what's excellent is you really only need to do it for, say, a trial of 2 minutes. If you started with 2 minutes of mindful breathing, counting to 4 as you inhale, holding the breath, exhaling to 4 or 5, and you did that for 2 minutes, and if you got distracted, you just brought your attention back to your breathing, you would feel better. Now, does it change the world around you? No, but it helps you regulate.
It should.
It helps you regulate so you can navigate more effectively.
I love that. Are you finding that you're teaching the same type of life coping skills to aging adults over and over again? And if so, what are the coping skills that truly work?
Well, first and foremost, it's normalizing that we all have emotions and that none of us are going to get through this without having a wide range of emotions. And that includes even the unwanted ones, which are sadness, frustration, anger, those things. We all want to feel the joy and the encouragement and all of those uplifting emotions, but that we're all going to have a wide range of that, and that we're not doing anything wrong when we have them. So the coping skills become really, first and foremost, education. And then it's about, a lot of times I use CBT, cognitive behavior therapy techniques, where we teach a person to be an observer of their thoughts so that they can notice their thoughts and maybe challenge them with a bit of evidence. So what's the evidence that that thought is true? That people really don't like you.
Yeah.
Can you explain
that cognitive? Yeah. Can you explain that cognitive behavioral therapy a
Yeah.
little bit more, like kind of dive into what it actually is?
Sure. So the basic premise is that we all have thoughts, right? And sometimes we have automatic thoughts that fire so rapidly that we might not even notice them. However, we grab a hold of them as though they're evidence. And then we experience emotions. And sometimes those emotions are the unwanted emotions, for example, like anxiety or sadness. And that's largely due to the thought or our perception of what's going on around us, for example. So it's basically that our thoughts impact our behavior, or our thoughts impact our emotions and can impact our behavior. So the intention is to look at the thoughts, look at the veracity of the thought, and say, perhaps that thought's not 100% true. Perhaps treating it as though it's 100% true is where my anxiety is landing.
Yeah.
My sadness is generating. And so what if I approach this situation with an alternative thought that perhaps I can, get out and meet one new neighbor, or perhaps I can go to the senior center and just take a look at it and see what it has to offer without getting into the no one will like me assumptions.
Yeah. Right. Because that is a slippery slope.
Right.
Yeah. Yeah. I think that's great. So now we talk a lot about, in our practice, the benefits of exercise and movement. So how do you feel like exercise, physical activity impacts someone's mental health?
Oh, it's a wonderful stress reliever, right? And a person can practice mindfulness while they're doing exercise, right? And I tell people, look, if for example, your physical therapist has asked you to do 20 reps and you're only able to do 10, then doing 10 is better than nothing, because you're at least working toward your goal. So exercise gives someone the opportunity to work towards goals. It can help them build confidence, and it can relieve that stress, because we know that when we exercise, we release endorphins, and endorphins help improve mood.
That's great. Yeah. So I want to move into a little bit about the stigma around counseling. I know that that's the biggest pushback that I see in our physical therapy practice is we'll make a recommendation of, maybe you want to talk to somebody about this, because a lot of times the mental health issues that people are struggling with come up in our sessions because we are a listening ear, and there sometimes is a lot of dead space when you're exercising and people want to have conversations. So a lot of times the same issues start to come up over and over and over again. And we will gently suggest that there are alternate professionals that are better at managing these issues than we are. But a lot of people just give a lot of pushback to starting counseling. Oftentimes they're saying things like, I can handle this on my own, or it's really not that bad. I'm just talking about it today. So how would you sort of work with someone on that?
Yeah, well, it doesn't always have to be a crisis to enter into counseling, right? I mean,
Yeah.
counseling can be about, let me just for a moment get some objective external support and talk through this. And many times too, Jenna, I think people say, well, yeah, I want to do this on my own. Well, I let them know, look, you do have to do the work. I'm here as your guide. I'm a
I
coach,
love that. Yes, I
you
love
know.
that.
I know the process, but you still have to complete the task or the run the play, for example, right? And so it's about you still do the work. I'm just here to give you a bit more direction so that you don't do it unassisted or do it without a clear path. And the other piece is counseling isn't always a lifetime commitment. I think for some people, especially the population we're talking about, perhaps they're aware of people who did enter into counseling and years and years and years and years later, there may be
Mhm.
times when that's appropriate to have ongoing treatment. But for some people, I've treated them for, 10, 12, 16 sessions. And then they're off practicing skills. Now, they may come back later for other reasons, but it doesn't mean every Tuesday for forever. It can mean a lot of Tuesdays for some time, right?
But then you'll eventually have tools in your toolbox that you can
Right,
manage
right,
similar situations on your own using those same tools.
correct. Hmm.
Yeah. So, okay, let's take the person that has decided counseling is for me. I need to get an appointment with Karen. What actually happens in that day? So they make their appointment and they come in to see you. What actually happens during that first appointment? So can you kind of walk us through what someone can expect?
Well, in our modern world, because we have so many opportunities for electronic charting, usually the person makes the appointment and then they fill out paperwork behind the scenes, right? They log on to, for example, with my practice, the patient portal, and they can go through documentation and fill in information gradually. They don't have to do it all at once, but they can give me some background that I can look at so that before they come in to see me, I can read about who Mary is or who John is and what their life has been like, and then ask specific questions and have some ideas ready for them. So that's a little bit of the backdrop. So in theory, they've already done some of that and signed consents. If for some reason the electronic world does not appeal to people, I do that paperwork with them in the first session. So that's also okay. But basically, that first meeting is about just getting to know the person, either based on what they've told me or based on what information I can glean from either electronic or written paperwork. And just saying, okay, what is it that your goal is in coming to see me? And then I meet that goal with here's how I can contribute to that. So it's individualized, it depends on the person. And I've had people say, I want to build self-confidence again because here I am now at this stage of life and I'm not sure what to make of the body I'm looking at. And so it's like, okay, then let's figure out together what that looks like. And so we problem solve and we collaborate and we say, okay, so our treatment goal is improving self-confidence. I know that I can help you by building some skills, and it can look like challenging some of the thoughts you have. And it can look like, pulling in some of the things that you enjoy so that you just in general build more positive emotions. So it's a collaborative process, and it's usually an appointment that lasts around 55 minutes.
Okay. I love that. I think that that's definitely how we approach our clients as well. With that collaborative approach of what is, I have lots of tools for you, but what is it that you want to work
Yeah.
on and how can I best help you? So very like patient centered, but again,
Mhm.
being that coach to guide you through the whole
Mhm.
process.
Yeah.
And what do you consider don't wait any longer signs, right? Where someone should really make an appointment?
Well, when they're noticing that really, okay, I'm not doing what I typically do. Maybe they're a person who has neglected their appearance, like, they haven't showered, maybe they haven't eaten, maybe they haven't seen people, maybe they're having those thoughts that life is a not worth living. I mean, it's painful to even say as a practitioner, but sometimes people lose hope. So if somebody's losing hope, that's a time to call, or that's a time to reach out to a trusted loved one and say, will you call with me? Or can you help me figure this out? It may be time to, even get checked out in an ER. We don't know if there's other medical things going on, right?
Yeah,
So,
absolutely. Absolutely. Now,
mhm.
do you guys see people just in your office, or can you do virtual visits as well?
I do in office and virtual. I do really a good mix of it. I've been at my private practice now for almost a year, after being in neuro rehab, where I also did a blend of in-person and virtual. So it's just still something that has really held on post-COVID, and it's just
Yeah.
convenient for people.
It
So,
totally is. Yeah, absolutely. They
mhm,
can, we have, our business was built off of people, older adults who have access issues, right? Can't
mhm,
drive, don't have a driver. And so,
mhm.
that I think that that's one great thing that came out of COVID is it has turned, a virtual option for virtually anything.
Yeah, it's accessible now. Health is
Yeah,
accessible.
yeah.
Mhm.
Yeah. So if you could leave our community with one message about emotional well-being as we get older, what would it be?
It would be that it's okay to take care of yourself. Taking care of yourself is going to aid to the quality of life that you have, and it's going to give you an opportunity to live life according to your values. Because if you're feeling well and you can reflect on your values, then you can live a bit more meaningful day-to-day life.
I absolutely love that. Love it. So, Karen, thank you so much for sharing all of your wisdom and expertise with us today. Before we get going, can you let our community know where they can find you if they want to learn more?
Sure. I am with a private practice called Hope and Wholeness Psychology Center. My main office is in Jenison, Michigan. I can be reached by email at ksvanslyke1219@gmail.com, or by phone at 616-379-97. I have to check 9798.
I can listen. I'll double check it because I will put it
Yeah,
all in
double
our
check it.
show notes in the bottom of the
Yeah.
recording.
Okay. Thank you.
Awesome. So I think one of the biggest takeaways from this conversation is that mental health, anxiety, depression, grief, loneliness, caregiver stress, these are all common experiences that lots of people have to navigate as they get older. But it's not something, they're not things that people have to face alone. And at Vitality at Home, we talk a lot about having people continue to do the things that they love to do for as long as possible. And while staying physically active is certainly part of that, true vitality also means caring for our emotional well being. It means staying connected, asking for help when we need it, and recognizing that seeking support is really a sign of strength and not of weakness. So, if today's conversation resonated with you, let this be a reminder that it's never too late to prioritize your mental health. Small steps really do matter, and reaching out really can be the first step towards healing and hope. And to everyone listening, thank you for joining us on another episode of Voices of Vitality. If you found this conversation helpful, please share it with someone that may need to hear it. Until next time, keep choosing the habits that keep you living your best life, because living your best life never gets old.